continuing to look at the work of Charles Hazzard with respect to written description. So the written description you would have seen before, pause to read it. If you didn't pause to read it, go back, look at it, pause, read it, then come back here. Talking about working in lateral. So talking about working in the thoracic region, he talks about grabbing the arm of the patient, right, above the elbow, and then having the other hand on the spinous process. So what you're looking at is something that looks like this. So hand on high on the arm or above the elbow, spinous processes. He says push downwards and forwards, or sorry, yeah, he says push downwards and forwards. Now downwards and forwards with respect to the patient, the arm would come this way. This is one of the challenges I want to note again with respect to writing descriptions. You have to be very careful how you write them, because when you read it, downwards and forwards on the patient's arm could look like that, right? But what he's really talking about is downwards and forwards with respect to the practitioner. So it's downwards and forwards, right, while springing to relax all the deep structure. So essentially he's saying work on the thoracic region of the spine or the vertebral column by using the patient's arm as a long lever and the practitioner's hand as a short lever, so you get a mixed leverage approach. Now you see, I'm going to run into his elbow no matter what happens here. So this isn't necessarily something that is going to work as well as you want in the high thoracic region, depending on the size of the practitioner and the size of the patient. So another way to do it would be here. You sneak under their arm, right, and then you press. So it's the short lever move and the long lever move for mixed leverage. Now, this is nowhere near as far as any of these structures can move, so I wouldn't suggest this is an ideal method, but this is essentially what he was talking about. You grab spinous processes, short lever, long lever for mixed leverage, right? He then talks about working in the lower portion, says a very similar method can be utilized. So what you're going to do is you're going to place the patient's thighs against the practitioner's abdomen, which essentially looks like this. And he says then you have two free hands. You can work on the muscles, right? You see how much he's wiggling there? So if I'm really working on the muscles, I don't know that I'm wiggling him here. I just pay attention to this. So if I'm not using my eyes, I don't see that, I don't notice that. So he's talking also about working on the muscles by pulling up, or working on the spinous process by pulling up, all right? So you'll see, if you pay close attention to my hands move, and a lot of him moves, especially above my hands. So I might feel like I'm pulling spinous processes up, but I may not be doing that. This is quite similar to another method that we already saw with respect to Little John, where you press into the patient's thighs to push the pelvis backwards and create extension, more or less. But in this case, the description suggests you're pulling up on the spinous process. Whether or not that's what Hazzard intended, that's what it would suggest. Now, the final portion of this description is talking about putting a forearm on the patient's, more or less on the patient's iliac crest and on the patient's shoulder, and pushing the forearms apart. Now, if I just take that superficially, it can look like this, right? So you see I'm sliding over the patient, but I'm pushing my forearms apart, right? So he doesn't necessarily tell you the intention of it or exactly how to position your forearm in relation to the patient's shoulder or in relation to the patient's iliac crest. So essentially, if you're going to use the iliac crest, you want to go above it so that it's a handle, and the down table forearm would be on that handle. Now here, because this is a round surface and I can slide over the patient's shoulder, it's probably not going to do anything. He's talking about spreading apart. So he's taking these 2 points and pulling them apart. Again, that's the only piece of intention that we get, but it's less clear than maybe we would hope it would be. But if you come under here and you do this, right, you can push apart reasonably well. Now you're going to get some sensation on your hands, especially because as your forearms move, your hands move. So you can think a lot is happening here, but what's happening is your hands turning on the tissues, right? So, and also depending on the size of the patient, I can only move so far. They can probably move farther than I can move. I think something's happening here. So it's a method that's easy to trick you. If you're trying to work on the soft tissues, you could do something like this. You can hook under the erector mass or the soft tissues generally, forearms down, good contact, contact is control, and then work on the soft tissue and use your eyes. So my eyes will show this is moving, right? So this is working on muscles, this is moving the patient's body. So yeah, I've got a bunch of fine on the muscles, but I'm also moving the patient's body. So this is the muscles, This is some other stuff. If I want the other stuff, I can get it, but it's not what I think it is necessarily. So those are the methods that Hazzard describes in lateral.